Well, now scientists at the University of Health and Allied Sciences are calling for enhanced social education on COVID-19 after a survey revealed about 45.9% of Ghanaians have exhibited stigma and discriminatory behavior toward COVID-19 survivors. The study revealed generally up to 43% of the population does not exhibit a good attitude towards COVID-19 survivors. The study, which surveyed more than 3,500 people across the country, also revealed about 24% of the respondents did not have good knowledge about COVID-19. The peer review study was published in the PLO's Global Public Health Journal on Wednesday, and lead author Dr. Hubert Amu joins us live via Zoom now for a conversation on this. Dr. Amu, thank you so much for your time. So what's more fascinating about this study that was conducted by your team?
Okay, thank you very much for the opportunity to speak about our research in such an important medium. Our study was very important because it came at a time that there were serious media reports of people who had survived COVID-19 being highly stigmatized and discriminated against in the country. So it was an important opportunity to make it scientific and then show that they are not just rumors, but they are actual things that are happening to those who have survived the pandemic.
But then you are also pointing out the issue of stigma. Is it a general situation? Are you generalizing here? Or perhaps there are some nuances to the definition and the scope in terms of what you term as stigma in this case?
Okay, thank you very much. In our study, as you mentioned, we studied over 3,000 people, and this was a nationwide study where we, first of all, grouped the country into ecological zones of 3, and then out of the 16, we had about 3 from each zone. So that's a total of 9 regions cutting across the country from all ecological zones. And then in each of these regions, we selected 2 communities, 2 districts, sorry. And then we made sure that we considered both urban and rural dimensions before we went ahead to collect our data. So it is not just nuances, but then we can confidently say this was a representative sample of the Ghanaian population. And so, yes, we can generalize and say the figures really reflect the situation at the time that this study was done, sometime 2020. Right. Yes, I agree that now a lot might have changed. Vaccination has come and a lot of people have accepted to get vaccinated. So the level of stigma we experienced at the time probably could be less now, but then the fact remains that a lot of people who have not vaccinated up to this point could still be holding on to some of these stigma, and that is one of the reasons they have not vaccinated up to this point.
And then the issue about knowledge, sufficient knowledge on the pandemic itself. How come till date, after more than a year of the outbreak, Ghanaians are still not coming to terms with what the dynamics of the virus may be?
Okay, thank you very much. So knowledge, it's holistic. Holistic in the sense that it's one thing hearing something and then another thing listening to it. The media has done a lot. The state, in terms of the government apparatus, has done a lot in terms of putting the information out there, but it behoves the individual to actually listen and then imbibe this information. But it looks like a lot of people, because of the stigmatized nature of the situation, they have held on to stereotypes which have prevented them to really take in the information. And so that is one reason I can say would result in the high levels of poor knowledge, which we found among the populace that we surveyed in our study.
And I'm interested in getting to know what the recommendations are in terms of changing the narrative and trying to deal with the challenges that you've identified.
Okay, so as you rightly mentioned, we realized that the prevalence was 46%, as you mentioned in your introduction, and then poor knowledge was as high as 34%, and then poor attitude was also as high as 43%. 43% here means that 4 out of every 10 Ghanaians that we surveyed had a poor attitude towards COVID-19. And so what are our recommendations? We are recommending that, yes, there's been a lot of public education for people to get to understand what COVID-19 is and to help reduce the stigma that we associate with the disease, which we then used to, for want of a better word, punish those who survive it. But then we need to do more. It looks like when the pandemic got so serious around the 2020s, where this study was done, there was a lot of effort by all stakeholders, the media, the national apparatus, NGOs, individuals, the health system. But it looks like after some time, we all went to sleep, for want of a better word. It means we reduced the efforts. And so it's no surprise that the prevalence is shooting up again. And so we have to get back to work and increase the education. And not just educating people, we need to make sure that we get the information down to the community level, because now what we are experiencing is the population level spread. So our main recommendation is for us to get back to work on education. Now, as I mentioned, not just educating, but then we can also get people who these communities trust, like medical doctors. So Joy News, for instance, you bring medical doctors more onto your shows, get them to talk to the people more. I believe that when we send the message out again clearly, it will reduce a lot of the misinformation, which fuels the stigma that we are experiencing.
Anyway, Doc, we'll have to leave it here, but I'm sure this is just the start of some more conversation to come. I'm grateful so much.